All right, guys, I'm Nicolette, and today Brian and I are here with Dr. Stephen Noble. He is the lead medical advisor at a company called LiveChair, and they're working on a pretty cool technology, and it's something I've never heard of before, so I am excited to talk about it today. But first of all, thank you, Dr. Noble, for joining us. We appreciate your time.
Thank you for having me.
So you have a pretty impressive resume. I mean, it is quite lengthy. You do a lot of amazing work in the medical field. So why don't you just kick us off by telling us a little bit about yourself and your background for the listeners?
Well, great. Again, it's a pleasure to be here. A little bit about myself. Originally from Portland, Oregon, which I currently live now. Went to undergrad at Xavier University of Louisiana, which is a historically Black college university in New Orleans, Louisiana. At the time, it was number one in putting Blacks into medical school. And so as a young kid, I always knew that I wanted to be a physician. And so it was just a natural sort of transition as far as once I graduated high school, ended up going to Xavier. And then from there, went to grad school and med school at Indiana University, fell in love with surgery. And so I came back home to Portland, Oregon for my general surgery training at Oregon Health Science University. At the time, met and married my wife, who's a hairstylist. And it was really during that time of being a general surgery resident, kind of seeing my wife and her clients and just really the relationship they had. And as well as understanding the relationship that I had with my barbers, having moved around a lot, understanding that the barbers, kind of similar to that Deion Sanders, look good, feel good, play good. So that notion of being comfortable in the barbershop kind of stuck home with me, and a light bulb sort of moment went off as far as marrying our two careers together. Fast forward to going into the Navy, spent some time in the Navy as a general surgeon, then did heart and surgery training at The Ohio State University, and then went back into the Navy and deployed, got out of the Navy, and then started practice. And it was really that entrepreneurial spirit started to kind of brew again as far as really trying to find something in which my wife and I could do together. And so came across LiveChair Health, this innovative platform that is looking to leverage both the trust that the Black community has in the barbershop and using that to really address social disparities of health. And so with that, jumped on board as an angel investor and have been the lead medical advisor for LiveChair Health, really looking to shape and reimagine healthcare for the Black community, again, leveraging that trust that we in the community have with our barbers and hairstylists.
Okay, just a side note, my husband, Brian, how many times every week he is at the barbershop and he will travel. Doesn't matter where we move. We're moving 45 minutes away and he is going to travel to Brooklyn to go get his hair done. The same barber, and he feels like he's cheating on his barber. At one time we went away and we were gone, and he was like, I don't know, he's going to know if I come back. I was like, you're insane. So this is a real thing. I mean, this is a real thing.
I mean, I have no hair. So for me, it's a razor. It's me. I'm my barber.
That's great.
But on that note, why don't you tell us a little bit about LiveChair and what is it? So tell us about
I want to know how it works. I have some questions.
How does this work?
Yeah, great. So LiveChair Health is a Black-owned startup company by Andrew Suggs, who really got into the business of trying to help barbers be better businessmen and women. So he developed a scheduling and booking app. And then as his father started coming to his life, unfortunately, his father started to develop early stage congestive heart failure. And that really led Andrew to pivot the company as he and his other co-founders started to really research why are there earlier rates of high blood pressure, coronary vascular disease? Why do Blacks die, at higher rates from mortalities from lung cancer, later diagnosis, things of that nature? They really pivoted the program to really look at this. And what they uncovered was that there had been barbershop initiatives in the community dating back to the 60s and 70s. However, these initiatives really never took hold. Oftentimes, there would be a funded program, maybe a grant, working with the institution. The program would do well, but the grant money would run out. And as soon as the grant money ran out, so did the program. So Andrew and the company decided to pivot to create a for-profit institution, really looking to answer the questions, would insurers pay for this, or would a provider networks pay for that? And so what we do is we leverage the trust that Black men and women have with their barbers and stylists. And so when an individual comes into the shop, they sit up there and they check in. And using technology, we have an app in which individuals can engage both with their provider as well as their client, as well as content on the app that gives them helpful tips on their diet, we can record and track their vitals, as well as give them information as far as what you need to do or what you should read before going to your first doctor's visit. Because oftentimes that first few doctor's visits can be a matter of trying to really establish a relationship. And what we're aiming to do is try to see if we can have individuals have a relationship somewhat similar to their barber or stylist to their healthcare provider. In the end, we just want to create more meaningful and healthy relationships between people and their providers.
Well, what's interesting too is, okay, so if you're going to the barber once a week or once every other week, you're getting more check-ins. So you're getting more data, which is definitely helps with monitoring anything health related. The more data you're putting in there, the more you can see any fluxes or anything like that.
How often do you really go to the doctor compared to,
right.
The barber every Thursday? I know. So I mean, and now are you sitting in a chair? Is the chair monitoring? Is it the app? How are you gathering that data?
It's a great question. So initially, prior to COVID-19, what would end up happening is the individual would come into the barbershop and they would fill out a health risk screening assessment, basically a set of 15 questions that gives us a host of data as far as family history of heart disease, whether they themselves have been diagnosed with high blood pressure, can they report that they've been diagnosed with high blood pressure? And then after we do that health risk assessment, we were training the barbers on doing a blood pressure cuff or wrist blood pressure cuff while they sit there in the chair. That information was then physically recorded on basically a business card, and the client would take that business card to their doctor's office. COVID-19 happened, and so we had to really reimagine how we did our business model and the product. The first thing that we did was we featured a financial workshop for barbers and stylists, because one of the things that the SBA Gov loan and the Triple P program really didn't take into account were these independent contractors, these IDCs, these 1099 individuals that are working in these barbershops. So once we had that and really were able to get the funding, we then started looking at the product and the app. So now when individuals go into the barbershop, they can use a QR code. That QR code then brings up the health risk assessment in which they complete. And then we start to do the blood pressure monitoring, and that information can get then inputted into the app. We're working with other companies to see if we can develop something to what you call an actual chair. And so we have some potential product partners that we're working and piloting so that when individuals come into the shop, they sit in the chair, they get their biometric data recorded, and then we can monitor them over time. And to the point that was raised earlier, I have patients that have what we call aortic aneurysm, just enlargement of their blood vessels in their body. And we tell those individuals, you need to monitor your blood pressure and your heart rate. And oftentimes when they come to me, they come with me with sheets of paper of this is what my blood pressure was, this is what my heart rate is. And when people come into the doctor's office to see, oftentimes their blood pressures can be several points higher than what it actually is. They're rushing to get to the doctor's office. They're stressful about seeing a heart surgeon about what I can possibly tell them. But when you get your blood pressure checked, that's at a place in which you feel relaxed, in which you feel comfortable, the numbers may actually be several points lower, and we may get a better true assessment of the data, such that the data that we get may be a true accurate measurement of the blood pressure, rather than this isolated blood pressure that we get in the doctor's office that could be elevated and then lead us to prescribe medication that the patient may not necessarily need to be on.
Right. Or even then writing it down, right? You lose that piece of paper, maybe you jot it down, you lose that piece of paper. I usually say to my doctor when I walk in, I'm like, let me empty my pockets because I'm not that fat,
Well, and to your point, Brian, I mean, having that stuff digitally available then is a lot easier to give to your health.
Yeah, absolutely.
To the healthcare, to your doctor, as opposed to pulling out all the papers from your pockets.
And what happens, and I'm not sure if you're doing this, but what happens is you could transmit that data, right? So if you have that data logged on your device, you could hand it off to your doctor or send it to your doctor regularly, or even, do you know what I mean? When you check in at your doctor's, here's all the data for the last 3 months or whatever the case is, and it's real data verse. I think I wrote a 9 and maybe that's an 8. You know what I mean? Like, because we all do that. We all do that. I was in a rush, or I lost it and I didn't take it on Wednesday,
So do you find, and I guess this is not a technology question, but more of a medical question, do you find that some people during the course of this program are a little bit more hesitant to give, I mean, I understand the concept of using the barber, but a little bit more hesitant to give out information even to the barber. I mean, I'm just thinking about my other half, if his barber, was like, let me check your vitals, do this. He's like, I'm fine, thanks. I just, even if he's not, he just, he doesn't want anyone to have his information. And, so like, how do you get past that? How do you get the community past that?
That's a great question. And so we do find that there oftentimes that when you're rolling out something new like this, there is a little bit of just hesitancy or skepticism as far as, what are we sitting up here implementing? And again, we have to understand that we are really looking to reimagine or redesign, how we sit up here and someone underscores or undergoes getting a haircut or hair service. And what we're really trying to do is have individuals understand that we don't want to disrupt that totally, but we're really trying to offer better care, better service, just really leveraging the trust. So to that point, part of that is just really getting the barber, the stylist on the team as far as really trying to understand. In the end, we're trying to impact health. We're trying to impact life, and we're trying to change people's lives by using the trust, the places that they go to on a weekly, often a monthly basis. And so to that point, it's really just encouragement and just seeing the process over and over again. And sometimes they may not check in the first time, they may not check in the second time, but as they start to see us over and over again, they really start to let their guard down. And a lot of times it's just really having those conversations, because that's really where this starts. The conversation between the hairstylist, the barber, and their client, and really taking that first step of improving their health. And so what we find is that maybe they do some aspect, they may download the app, but they may not input all the information. They may see some of the articles, but they may not fully engage. But we're hoping that over time, as they start to build the trust with us, that they've kind of adopted us into their space through their barber and through their stylist, that they start to understand that we're here for them to really help them with this journey.
So, it's interesting. You mentioned the content, because I was going to say, does the content sometimes, as they're reading it, maybe they're not putting their data in, but they're reading it, does that sort of prompt them to go, oh, I may have that issue. Let me start monitoring myself. Let me start putting the data in, and
so
also,
yes.
Sorry. No.
You're exactly right. So the content, one of the things that we found is that an individual would go to their doctor's office, and the doctor would say, well, you can't eat this, this, and this. And so the client, the patient left dejected, like, well, what can I eat? And so we recorded this message in the barbershop. And so we just told the individual, just go to our app, and there's a host of recipes, eating habits, and things that you can really do to engage, to really kind of figure out what's the best thing for me, and trying to take it that step further as far as not necessarily just telling people what they can eat, but what they can and how they can cook it in such a way that it'll make it more edible and pleasing to them.
Right. So now so you're putting in all this data to the app. Now I'm going to get all technical on you. You're putting in all this data to the app, right? Are you using any AI to sort of do predictions? Like, you see something, maybe it's like, hey, and there's nothing, the app's not going to replace the doctor, but, it may go, hey, maybe you should get checked out, I've noticed this irregularity in the patterns or something like that. Do you have anything, or do you plan on adding anything to the app that has something like that?
So the answers to that are no and yes. So currently we don't have anything to that capability and function, but those are the things that are on the product roadmap. And so what we have as far as LifeChair Health is, we have what we call the Brain Trust, a collection of healthcare individuals that really help give LifeChair Health advice and guidance in regards to the medical aspect. So it's led by myself, a cardiothoracic surgeon. We have cardiologists, public health researchers, individuals in health policy and equity, because we're looking to leverage this data that we're able to obtain and really affect the upstream issues as it relates to healthcare and social disparities of health, and really looking at zip code data. And as we can, and to your point, using further advances in technology, AI, if we can predict some of these things, maybe we can sit up here and affect the change. If we find that individuals are reporting on their health risk assessment, my diet is unhealthy, but then we look at that zip code and find that they live in food deserts, maybe the health policy that we need to do is talk about urban farming within these communities, so that these communities have access to healthier foods rather than access to some of the things that we see all too often in some of these communities.
Yeah, no, that's very important, because
that predictive portion, I think, could really impact the future.
And especially as, like you said, with that, with being able to target to like a particular zip code, you could figure out things and what is happening in that particular zip code that's actually maybe causing it for this group of people, right?
Correct.
So, okay. So now I'm going to ask you, okay, so can you give us your best heart healthy tips? I mean, what should, and I'm sure this differs, right? I mean, so you've got age, race, gender, right? So how does this, I mean, at what point should you really be considering your heart health? Like, is it like out of the womb you should be like, I got to keep my heart health? Like, at what point does this start?
I think you're exactly right, out of the womb. And so a lot of this is family history and genetics. And so, family history, and really part of our family history is genetics, but oftentimes it's cultural, it's conditioning, it's what we eat. As a kid coming up, it was one of those things. Oh, you can't leave the table until you finish all your food. Mm-hmm. And I was one of those type of individuals. I'm just going to sit there because I'm just not going to force feed myself. Just regardless, it was just I didn't like that feeling, and so some of these things we have to kind of get out of as far as understanding, just some of the traditions and/or some of the practices that can lead to unhealthy cardiovascular health. So one, it starts with from the womb. Nutrition is very important. Our heart is a pump. It's a machine. It needs optimal fuel and energy to work. At the same time, you have to exercise, and so getting that heart health exercise, 30 minutes, of cardiovascular activity at 5 times a week, if not every day, is great. Walking, so doing those sort of aerobic movement is great, and you really got to get your heart to work out. And so between diet, exercise, those are the things that I think really kind of are the fundamentals of heart health that anyone should do and can do. And regardless of race or demographics, those are some of the prescriptive things from beginning to end that all of us should be doing as far as being heart healthy.
But there are certain groups that are more susceptible, correct?
Correct. And so to that point, that is, again, as we talk about social determinants of health and healthcare disparities, again, looking at family history is one of the biggest things that can really be predictive. In addition to that, smoking history. And so if you smoke, you're most likely, and again, smoking is going to affect those microvascular, those very small blood vessels. Smoking is going to wreak havoc on small blood vessels, which again is going to wreak havoc on the heart. Diabetes, again, is going to wreak havoc on very tiny blood vessels. So if you have a history of early heart disease in your family, then you have a history of diabetes and you're smoking. Those 3 things are really going to wreak havoc. Both and so to that point, it's really about changing oftentimes behaviors, but again, access to healthy foods, access to things to really economic resources, housing, things of that nature. All of it kind of comes into play to really improve and affect health in a positive fashion.
So where are you seeing, where should we look? I mean, as a country, where are we seeing LiveShare pop up? I mean, are you using the zip code data? How are you starting how has the company rolled out?
So LiveShare Health is based out of Baltimore, Maryland, and so we have 30 shops in the Baltimore area, also in PG County, some areas in DC. But we're a national organization from the standpoint of I'm out here on the West Coast, and we have team members up and down the East Coast. And so in our current sort of iteration of the company, we have identified 2 customers, both on the provider side, provider network, as well as the insurer side. And so with that, we're looking to expand up and down the East Coast and eventually out here to the West Coast, identifying markets out here in the California area, as well as in the Pacific Northwest. So with that, you will find LiveShare Health barbershops primarily in the Baltimore East Coast areas, some areas in the DMV, and then also we're expanding some shops in the Carolinas.
That's really cool.
And the plan is to go nationwide, right? That's the goal.
Exactly, go nationwide. So yeah, we definitely have some interest from across the pond in Great Britain, and so Andrew is really just a remarkable CEO and has really garnered some interest there, as well as some interest from the islands. And so it's really just a remarkable aspect. We've seen that this model has been done in the islands, in Jamaica, and things of that nature. And so it's really just a matter of how can this model that has been done and borne out in the LA barbershop studies with Dr. Victor, with the great luminaries of Dr. B. Wayne Kong and Elijah Saunders, how can this model go from what it was before to a for-profit entity, and not just and that for-profit notion is really about sustainability and scalability. And that's really trying to take this so that it's not just in one particular zip code, but being able to create a model that is sustainable and scalable across the globe.
That's awesome. That is a really cool thing. I'm really excited about that. Is
You're
there
doing
anything
some
else we
great.
should know? Go ahead, Brian. What were you
No, I
saying?
was gonna say you're doing some great stuff for humanity.
Yeah.
You know, you really are.
And in a really unique way. I was like, I gotta find out about this. This is cool. Is there anything else you want to tell us about lecture before we let you go?
So every month, Live Chair features a crucial conversation. So we have these webinars in which we just really try to have that virtual barbershop sort of feel. And so the first month is in January. We kicked off with ways and try to have a healthy and positive start to 2021. Questions in regards to how to have a better relationship with their primary care provider. The second month in February, we talked about COVID-19 and taking any and all questions in regards to the vaccine. And so that was really a great sort of conversation to really take those questions from the streets, the questions from the barbershops and the hair salons, and really dispel the myths, as well as just give basic conversation that sort of barbershop talk. And then this month, we're talking about nutrition. We're talking about colon cancer. We're talking about listening to your gut and the impact that has on not only just cardiovascular health, but as we talk about March and it being colorectal cancer month, and some of the individuals that we lost again, Chadwick Boseman, this is an opportunity for us to really get the year started, because we know that with colon cancer in particular, we get diagnosed at a later stage. However, if oftentimes it can be diagnosed earlier if we do the appropriate sort of screening. And so each month we're going to have these regular sort of crucial conversations, these barbershop, hair salon sort of conversations, to allow the community to interact with us, interact with our hair professionals on the app, as well as being able to ask questions to providers. So check that out. It's going to be on our YouTube page and YouTube channel. And then again, individuals can go to www.livechair.co to find more information about LiveChair Health. They can download the app. Our app is currently available to anybody and everybody on Android, as well as iPhones and the Apple Store. You can take a look at the content that we have, as well as interact with the app to really get everyone back on the path of healthier living.
Thank you so much, Dr. Noble. Thank you for your work.
Thank you.